Preparing yourself before microblading session. Microblading is a form of tattoo artistry because the pigment is implanted under the skin, although it's all done with a small hand tool and not with a machine to create those tiny hair-like strokes. With this little tool, the pigment is not as deep as a regular tattoo. Thus, it isn't permanent, though it still lasts quite a while. Why are there restrictions before microblading session? To do the microblading session, the technicians will cut the skin while putting the pigments. Just like other skin cutting activities, the client needs physical preparations. While the skin is healing, the ink stays under the cut. Scabbing and aftercare required, but your microblading will eventually heal within 30 days. However, pre-appointment care is needed to keep the aftercare controllable to make the aftercare healthy. Having said, you need to prepare yourself before your microblading appointment. The following guidelines are to ensure your skin is in the best possible condition for an excellent microblading procedure. Follow these guidelines unless your microblading technician directs otherwise. What to do before microblading session. Some clients make preparations even if they haven't made a microblading appointment yet. It is because some people do not qualify for microblading. That is why the first step is knowing if you can or cannot get microblading before getting it done. You can check if you are qualified to get microblading here. Consult first with a patch test behind the ear to make sure there are no allergic reactions. There are different types of microblading inks, so you can try other ones if you are allergic to one. Sometimes a client's skin undertones may have unexpected effects on the ink's color, and the artist may need to add color to adjust. These kinds of corrections are typical with any microblading artist and an essential part of the process, as everyone's skin is different and receives ink differently. Because people have different skin types, some skins are ideal for microblading, and there are challenging ones too. However, the drier your skin, the better the result. To make it easier for your microblading technician, drink less water up to the microblading procedure. Be prepared to lie very still for an extended period. Many patients bring headphones to listen to music during their appointment. Also, wearing comfortable clothing will help. Clients often like to wear a sweater to help keep them relaxed. Showing pictures of your ideal brow shape or color can also help you to communicate your aesthetic goals with your microblading technician. What to avoid doing before microblading session. Keeping up with the trend is not so urgent. Some microblading artists are up to date with the trends. That is why finding the best microblading artist in your area should also be considered. Thus, it is best to plan months or even a year before they get their eyebrows done. These are the treatments or activities that you should avoid before your microblading session. Avoid these 1 year before microblading. Acne medications such as Accutane or Retin-A within the last year have an altered skin condition that will not heal well after the procedure. You must wait a year before tattooing the skin. Avoid these 3 to 6 months before microblading. If you have been using Latisse or any other eyelash or eyebrow growth conditioners, the skin in that area is in a hypersensitive state and will bleed easily. Be mindful of discontinuing using these at least 3 to 6 months before going in for a session, otherwise, you will instantly bleed profusely. Avoid these 1 month before microblading. If you have Botox or other fillers, we will create your brow based on your Botoxed features. Once the effects wear off, the brow placement may not settle where you want it. Avoid chemical or laser peels, acids, microdermabrasion, skin needling, or anything that intensely removes layers of skin close to the area to be treated. They will cause skin cells to regenerate faster, resulting in skin irritation. Retinol and Vitamin A users should discontinue the use of each a month before microblading. They may thin or sensitize your skin and could cause your skin to tear. Avoid these 2 weeks before microblading. The skin should not be in the process of healing before the procedure. Avoid direct sunlight, and especially sunburn 2 weeks before. Also, do not have any facial or peel 2 weeks prior. Refrain from using any Alpha Hydroxy Acid (AHA) products close to the eyebrow area 2 weeks before and 2 weeks after your procedure. Check your moisturizer, face wash, BB or CC creams, and makeup primers for anything that says acid. Avoid these within the week before microblading. Do not pick, tweeze, tint, wax, thread, or have electrolysis in your brows 1 week before microblading. These can also trigger the skin healing process. Avoid moisturizing the brow area for a couple of days before, making it easy for your technician to achieve maximum results. Do not take fish oil or vitamin A 1 week prior. These are natural blood thinners. They can thin the blood and lead to excess scabbing, which would give patchy results. The same goes for vitamin C, E, and flaxseed oil. Avoid aspirin, niacin, vitamin E, and ibuprofen, omega-3, unless medically necessary, 48 to 72 hours before the procedure. Avoid these the day before microblading. Please do not work out the day of the procedure, as the body heat will expand the pores. Avoid alcohol for at least 24 hours before and after, as it increases bruising and thins the blood, making microblading trickier. Do not drink coffee or anything with caffeine on the day of the procedure. Yes, there is caffeine in decaf coffee and tea. It will minimize any oozing or swelling after the procedure.